And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Good to see you this year.
Hey, yes, you too. Absolutely. Happy New Year.
Happy New Year. So flu, obviously rampant here in Southeast Texas. What can you do to prevent the flu?
I mean, we talked about it last week, and actually there's been a huge increase this year. A lot of sick people, a lot of hospitalized people. Some people are dying, unfortunately. But certainly the big thing is getting the flu vaccine. Is still available until early next month if unfortunately you don't get the flu vaccine, because there still is a lot of fear out there about a possible reaction to the vaccine. Tamiflu is a tablet medication that you can take within 48 hours of onset of your symptoms. Certainly if the symptoms are severe, we still will give the medication beyond 48 hours. So the bottom line is get your vaccine. If you don't, then get to your doctor if you feel like you do have the flu.
And there are lots of places that you can get that vaccine right now.
Doctors' offices, the pharmacies have done a tremendous job for actually the past several years providing immunizations, not necessarily the flu, but the issues with pneumonia vaccine, shingles, pertussis vaccine. The pharmacies are doing those vaccines very well. I don't hear any complaints. You can walk in most of the time, anytime, and get that vaccine. There's no long waiting line. The expense is normally not that bad either, so it's a good deal.
Even if your insurance doesn't cover it, it's normally less than $30?
Typically it is. I don't hear a lot from the patients about an enormous expense for the flu. Now, some of these other immunizations might hold a hefty price, and it depends on your insurance company, but for the flu, it is available. They have a few varieties of the flu immunization. I'm not that well versed on all the different ones because I'm still just trying to get the patients to get one. I don't care which one, just get
the
one.
flu shot.
Just get one.
I finally got the oldest to get his flu vaccine. We're all vaccinated now.
Very good.
And anybody over the age of 6 months should get vaccinated?
Absolutely.
All
yes,
right.
ma'am.
On to some of our viewers' medical questions. This viewer wants to know, I had surgery 4 months ago. Now I have a Charlie horse in my back. Is that good or bad?
I don't think it's neither. I mean, I don't know that it's necessarily related to the surgery. 4 months is quite a long time in terms of it being related to the surgery. Certainly get some x-rays, blood tests. It could be dehydration, could be medication side effects. Sometimes we try tonic water for cramping, so certainly get evaluated, don't let it go.
Okay. This person has smoked for 35 years and they've just quit. Is it possible to rejuvenate your lungs to a healthy state?
I think it's more about preserving the lung function that you do have. I mean, I don't know about rejuvenation. The body does heal itself. It takes a long time, however, on the order of 10 or 15 years from not smoking to kind of get back to where you were if you didn't smoke. So I don't know that you rejuvenate. It's just the body healing itself and then preserving what you do have.
It's a healthy step.
Oh, absolutely. There is no question. I think smoking, in terms of that habit, is huge negative detrimental aspect on your health. Smokers tend to do a lot worse. They have premature illness in all categories. It's just not a good thing for your health.
It's not just only for your lungs, it's your heart and everything else.
And it's also the people that are around you. We're understanding that people who are exposed to secondhand smoke, we're talking about people in the same environment, frequently, repeatedly have some of the same diseases that smokers do have. It's an extremely potent issue, so beware.
All right, another question. How can you tell if you have the onset of the flu?
Typically it's going to hit you like a rock, basically, from one day or from 1 hour to the next. A lot of aching, some low-grade fever, a dry cough, you just don't feel well, you feel terrible. That's normally how the flu presents itself. But viruses are tricky. They sometimes don't present classically, so it's up to the physician to listen to a patient, do an examination, maybe do a throat swab, and put it all together to see if that is the flu.
All right, another question. There are different brands of flu shots. Do they contain different things? How do you know which one to take?
They're engineered just a little bit differently. Some are what they call trivalent, quadrivalent. Some are quote stronger. So yeah, they are tweaked a little bit differently, but at the end of the day, it is supposed to help protect you against the flu virus of the year.
Just take a flu shot.
Just take one.
Matter.
Yeah. That's the big issue. Just take one.
All right. We've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. 51-year-old woman has pain in her hip that goes into the groin area. Any idea what the cause could be?
Yeah, probably degenerative joint disease of the hip or pelvic area. We normally can do an x-ray and see just how bad it is. We start off with anti-inflammatories, Mobic, Aleve, Celebrex. Certainly if it worsens, you can get with your orthopedist, maybe think about hip replacement. But normally you start with that
Isn't
first.
that too young at 51?
Well, if they need it, they need it, and it's normally based on symptoms. Certainly you can wait, but when it gets severe, it is so painful. You can't walk and you have to go to work. You have to take care of your kids, so there are some people out there who are getting those replacements at that age.
All right, a 58-year-old man has nasal allergies, went to the doctor, has taken several nasal sprays, taken over-the-counter. Nothing seems to help. The smell of food seems to make it happen, seems to make it worse. Anything else that he could do to alleviate those allergies?
Yeah, keep going back to the physician and working with them. There's an anticholinergic medication called Astelin that works pretty well. I would probably get some sinus x-rays or CAT scans of his sinuses to make sure there's nothing anatomical, such as polyps or narrowing. Some people believe in the neti pot. It is a little device you can get over the counter, put some sterile normal saline in there and wash out your sinuses. So those are some things that he can try, but certainly keep following with your physician. Sometimes these are just difficult cases. You just have to kind of keep going back, grind out the issue. Just don't give up on the physician.
General practitioner or go to a specialist, ear, nose, throat?
Probably in that situation, ear, nose, and throat doctor. Certainly start off with your primary care physician. A lot of times they can knock it out, majority of the times, but in these type of cases where it just keeps going on and on, they're failing medication, get to the subspecialist, may even need an allergist to look in on that person and offer their comments.
Okay. A 52-year-old woman, a smoker, on oxygen. She's losing weight. Is smoking and oxygen causing the weight loss?
No, I think the lung disease is. You have to understand that when the lungs start to fail, it behaves chemically just like a cancer or a heart that's failing. It starts to produce hormones and chemicals that reduce your appetite. A lot of times you have to breathe more rapidly. You might not notice it, but you breathe more rapidly. You're burning a lot of calories, and a lot of times you just start to lose weight because of that combination. You're not eating a lot of food because you have a poor appetite. You're burning a lot of calories because your lungs are working extra hard because they're failing because of the smoking. So it's all related to chronic lung disease.
Okay. How early is too early for a flu shot when you're pregnant?
And I don't exactly know that. I mean, I think we've just been so aggressive at trying to just get people on board with the flu vaccine. If it's available, go out and get it.
Okay. Can you explain blood-brain barrier?
Yeah, it's just special capillaries in the brain that offer special protection to get access to the brain. You know, the brain is a very sensitive structure, and so these capillaries are formed differently to protect them against all sorts of chemicals that enter your bloodstream. So it's a blood-brain barrier, just kind of an extra protection that the brain has.
Okay. A 46-year-old woman, her knee hurts all the time. The doctor says he can't find anything wrong. What could be the cause of the pain?
Yeah, again, maybe an MRI would be very helpful. Maybe it's referred pain from the lower back, so an MRI of the back would help. Sometimes a topical medication might help as well. And again, might need another physician for a second opinion. But again, don't give up. Just keep going back to the doc and keep looking for things that might be causing the problems.
Okay. What causes cramps in your hands, feet, and arms?
A lot of times, in my opinion, medications can do that. Diuretics, cholesterol medications, dehydration. Again, we try to use maybe tonic water, maybe adjust the medications.
What's in tonic water?
Quinine, which is no longer offered over the counter other than tonic water or prescription. So I like to use that medication. It works very well.
All right, Dr. Levine, as always, we appreciate you stopping
Yes,
by.
ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax is 892-7305. Email us at laf@kftm.com or post those questions every Monday on our KFTM News Facebook page.